All right, so good morning, everyone, and welcome to this course of clinical examination for particularly aimed at the FCPS. I also welcome Salman and Heather. They are already here for you, and we are going to start just in about 4 to 5 minutes. So, just to take you to the background of this course was initially started in 2021 when we conducted the first ever course in Lahore in Mayo Hospital. And it was the first course where all the examiners from different cities were there. Uh, Today, you will be getting examined by three of us. We all are the fellows of College of Physicians and Surgeons and fellows of Royal College as well. We have been working on this teaching and training for the last 4 years, and it was just built up because we all studied together, prepared for the exams together, and then we have come up with this idea. This has been going for the 4 years, but now we are trying to rebuild it and make a group that can help others. You all are welcome to join this group once you have passed the exam. The purpose of today's course is basically you all are bubbling with knowledge at the moment. It will just be to have a rehearsal. So make as many mistakes as you can make today so that you do not make any mistake in the exam. We will be short of time, running out of time. That's why we might not be able to answer all of your questions. So if you have any questions, just keep those questions with you, and you can later on ask me, Salman, or Heather, and we will love to answer all these questions. So today we are basically going to give you a rehearsal of the exam. So now I will request Salman to give a bit of an idea of today's course. Salman, can you start, please?
Can you hear me clearly?
Yeah, we can hear you. Thank you so much for joining so early.
No, thank you, Irfan. It's a wonderful course. So will there are so many candidates. First of all, I would like to apologize. We can only accommodate limited number of candidates as per our time schedule. We want Obviously there are other people here as well observing the course. So if you have any questions, you can always put up in the notes and we can answer those questions later in the end. We'll start with the candidate one, and each candidate will have two oral stations, talk stations, and then which will one station will be of 4 minutes, okay? And 1 minute will be for the feedback for each station, and then we'll move on to the two short cases, which will be 4 minutes. I know in exam it's about 5 or 6 minutes time. We have tried to cover the topics which are most commonly asked in exam. We know that in exam anything can come across. Be prepared for anomalies that you think that this cannot come in the exam. This is my message for you guys. So keep your mind open. If anything unexpected come in the exam, so I would say just stick to the principles, like just describe the deformity, just describe the basic principles. How will you assess? Just stick to the basic things, that this is the thing that you are looking for in the examination. And if you don't know the diagnosis, then please come up with a differential diagnosis at least. And the other uh, thing is we'll do the two short cases. And the idea why we skip the long cases, because the pattern in Pakistan is a bit long, and we know it takes half an hour. You will be given to take history examination, and then there will be half an hour for an viva. So that's why we stick to the talks and the short cases. Hope you will like these cases, and please give us a feedback at the end, please. All right.
Thank you so much, Salman. This is a very valuable advice. Exam is just about sticking to the principle. If you get encountered with a case that you don't know at all, just know the principles. So Today, all of you who are going to take this course, basically your knowledge is much more than our knowledge. We are just going to take you through a rehearsal, basically. I will request Heather to give a brief uh, introduction of himself as well, and then we can go ahead. I would like to tell you that Salman is one of the very bright candidates and a very good orthopedic clinician. He's a member of the Royal College. He's a fellow of the Royal College as well as College of Physicians and Surgeons. He is also MD. He is full of knowledge and has attained membership and fellowship of almost every country at the moment. He's working in Royal Derby, and he's one of the best candidates that has also helped me and Heather during our exams. So, Heather, can you please give a brief introduction, and then we will go ahead in 1 or 2 minutes? Heather, can you hear us?
Heather, please unmute yourself.
Yeah, I'm unmuted. Sorry. Welcome everybody. Yeah, it's a wonderful effort by Irfan especially and Salman as well. So it's this effort is purely based on intention to help our juniors and based upon this idea. So we all three have like studied in both these exams most of the times together, and it's the same idea, like we got through the exams and how we can help our juniors in a better way, taking start with the FCPS exam, and just to think about our next new prospects, how we can help others, and to improve the knowledge, and how we can improve our presentation and delivery of the knowledge as well. So it has been designed very well by Irfan and Salman, a great effort by both of them. So yeah, I hope so you will enjoy and benefit from today's course. Yeah.
Thank you, Heather. Heather is currently working in university hospitals of Birmingham, and we have always admired the clinical skills of Heather. Heather is very good at clinical skills. So, without any delay and wasting any of your precious time, I know it's very critical time. So, I will start the course. I'm not sure which candidates are here or not. Many of the candidates didn't confirm. So I will ask the name. If that candidate is here and we can start the Viva, please in the chat box, you can say I'm here or unmute yourself and say I'm here. So the first candidate, Kafayatullah, is he here? If Kafayatullah is not here, then the next is Dr. Tariq from Karachi Civil Hospital. Dr. Tariq, are you here? The next candidate is Asadullah Solangi from Karachi Civil Hospital. Are you here? You can chat in the chat box. You can mention or you can unmute yourself. Asad. So Asad is here.
Yes, sir.
Let's start.
Yes, sir. Me.
All right. Good morning, Asad, and welcome. Let's
Good morning, sir.
start with you. So this is the first case, and your examiner is Salman. Salman, can you please proceed?
Thank you, Irfan. Irfan, can you please put the timer on?
Yeah, I have the timer. Please start.
Yeah, Asad, are you ready? Shall we
Yes,
start?
sir.
Okay.
Yes, sir. Yes.
Okay, so just be confident, okay?
Okay, sir.
So this is the scenario. This is a 15-year-old boy who was playing rugby and was tackled by the opponent team. Can you see the X-ray? Can you describe the X-ray for me, please?
Yes, sir. This is plain radiograph of a skeletal mature patient, right shoulder joint. Oh, this is some part of proximal humerus. Sir, I can appreciate there is a dislocation of the right shoulder joint.
Mm-hmm. Okay.
Yes, sir.
Okay.
Sir, for further comments, I would like to have another use to
Okay, very good.
direct. Yes,
Okay,
sir.
so
To tell the.
let's
Yes,
imagine
sir.
that this patient has presented to you in ED. Okay,
Okay,
how will
sir.
you
Okay.
proceed? How will you
Sir,
assess
in
the patient and how will you
y-
proceed?
yes, sir. In emergency, I will start with the ATLS protocol. First of all, I will be sure that the patient is hemodynamically stable.
Okay.
Then, sir, I will check the neurovascular status of the patient after,
Okay.
and then I will reduce it under sedation
Okay.
by different methods like Walker and Thompson methods, sir.
Okay, that's
I
fine.
will, yes,
What
sir.
will you
Then
do
after,
next? Yeah.
yes, sir. After reduction, sir, I will also check the neurovascular status of the limb and then check X-rays to
Okay.
see whether it is reduced or not reduced or any iatrogenic fracture happened. Okay, sir.
Okay.
Yes, sir.
That's fine. Anything else? What?
Then, sir, I will apply the grab bandage, sir.
Okay.
Yes, sir. Body bandage.
Okay. So this is the emergency management you have done. How will you
Yes, sir.
proceed next? What will you do? What will you tell the patient?
Sir, I will tell the patient to follow in my OPD, sir, and
Okay.
I will then do further X-rays and when it comes to in my OPD or in my follow-up to see
Okay.
the sir position. Yes, sir.
Okay. Assuming that you have done the X-rays and it is reduced now. Okay. So you have asked the patient to come to your OPD. What will you
Okay,
do?
sir.
So assuming that patient has come to your OPD after a few weeks, what will you
Yes,
do
sir.
next?
Yes, I will, sir. It is if it is stable, will I will advise him physiotherapy, sir. Physiotherapy of the shoulder.
Okay. Anything else would you like to do?
Sir.
So, okay, let's make it simple. So if it is a recurrent, if it is a case of recurrent shoulder dislocation, what will you do?
Yes, yes, sir. I will advise him MRI, sir. It is recurrent. It is recurrent. Then I will take the history, sir.
Okay, that's fine. Can you
If
see the MRI picture? Can you see anything?
yes, sir. I appreciate, sir. There is hyper-intense lesion, sir. On the yes, sir.
Where?
This yes, sir. This one on the
Okay.
antero superior aspect or inferior aspect. I can't.
Okay, that's fine. Are you aware about the Bankart or Hill-Sack lesion or anything?
Yes, sir. Yes, sir. I am.
Irfan, can
There,
you
bank.
please go back to the X-ray? Is there anything evident on the X-rays?
Yes, sir. There is depression, sir. It is the posterior aspects of the humerus, sir. Maybe,
Okay,
sir.
what
It
is it
is
called?
Ilseclian, sir.
Hill-Sack lesion. Okay, that's good.
Yes,
Are you aware about any other X-rays view that you can take?
yes, sir. Scapular view, sir.
Okay,
Axillary views, sir.
okay.
Valpe,
Anything else?
Valpe view, Valpe view, sir.
Mm-hmm.
Yes, sir. And sir, for the AC joint, sir, if it is also disturbed, West
No, I'm
point
not.
view,
I'm
sir.
not asking about the AC joint. Just stick to the what you are seeing. Just stick to
Okay,
the shoulder dislocation. Okay. Are
okay,
you
sir.
aware
Okay.
about the striker notch view? West.
West point, yes, sir.
Yeah.
Yes, sir. Yes, sir.
What is
Striker arch for the Ilseclian, sir.
Hill-Sack lesion? Okay. And
Yes, sir.
is there anything simpler than striker notch view and another thing? Just the AP view. Can you do any modification to see something?
Time's
Sir,
up.
internal view, sir.
Hands up.
Time's
True,
up.
sir. True AP view. Yes, sir. Okay.
Okay, we'll come to the. Should I give the feedback now, Irfan, or in the end?
After two talks, I would guess. I
After
would
two
say.
talks, okay. Okay, Asad, so let's move on to the next one. Okay, so read the scenario very carefully, okay? So this is a
Yes, sir.
59-year male who has a pain in the thigh for a long time and difficult weight bearing, okay?
Yes,
This
sir.
patient has come to your outdoor and this is the X-ray. Tell me what you can see in the X-ray.
Yes, sir. In the X-ray, I will see the lesion. I will see the lesion.
Mm-hmm.
Lesion is in the right femur, sir. I will also see the extension, soft tissue extension. Any fracture, sir. It is seen and obvious in this X-ray. Any
Can you see
pathological
soft
fracture.
tissue extension here or not?
Yes, sir.
Can you see
No,
a
no,
soft tissue extension?
no, sir. In this X-ray, I can't appreciate it. There is, sir. I'll also see the thinning of the cortex, sir, in this X-rays.
Okay.
Okay, and
Can you
the
see anything else? Any fracture?
pathological fracture is there, sir,
Okay,
also
good. Okay,
non-displaced.
so this is patient has come to your OPD. How will you manage this patient? What are the investigations you will do, and how will you?
Yes, 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 sir. If this patient comes to me in my OPD, I will start with the sir as hematological workup, CBC, ESR, CRP to rule out any infection, sir.
Okay, yeah,
Yes, sir.
yes,
Then I will go, sir. Then I will do the then do the metabolic workup, sir. From
okay.
calcium, vitamin D. Yes, sir. Then
Calcium and vitamin D. Anything
yes,
else?
sir. Then the sir I will sir alkaline phosphatase, sir.
Okay, good. Anything else? Come out of the bloods. Is there anything else in terms of
Yes,
investigation you will get?
yes, sir. If it is, I will also go for the sir prostatic specific antigens to rule out any prostatic tumor migrating
I'm
there.
saying
Yes.
come out of the bloods, please. Think out of the box. Is there
Okay,
any
sir.
other
Oh,
investigation you will go for?
yes, sir. Bone scan, sir.
Bone scan. Okay.
MRI,
You will go
MRI,
right
sir.
into the bone scan.
Yes, sir. To see the distant metastasis, sir. Then, sir, I will go for the MRI, sir.
Okay. What will
Also,
you look for in MRI?
sir, in MRI, I will see the extension of the sir tumor,
Okay.
any neurovascular involvement,
Okay.
and
Very
then
good. Anything
yes, sir.
else?
And
Just the
MRI,
bone
sir.
scan and MRI. Anything else?
There is full X-ray femur, sir.
Okay. Good. Yeah.
Epilateral view, sir.
Okay. Very good. Anything else? Can you think of anything else? No? If not, just say no. Okay. If you can't think of
Yes.
anything, just say sorry
O-
and move on. Okay.
Okay, okay,
Don't
okay,
stop and
okay,
waste your time.
It's
Okay.
a
okay, sir.
time game, so just utilize your time.
Yeah.
Okay, sir.
Okay. So can you quickly tell me the principles of biopsy?
Yes, sir. The principles of biopsy are there. The biopsy should be taken in the institute where the definitive procedure is also done after
Yeah.
that,
Okay.
and done by the person or surgeon who knows the reconstructive procedures or
Very
definitive
good.
surgery. Yes, sir.
What else?
Uh, biopsy should be done with the tourniquet, sir, but not extubated.
Okay.
Biopsy should be done with a small incision as possible as small in a longitudinal way, sir.
Time's
Don't
up.
don't disturb the sir
Time's
Time's
other
up.
up.
compartments.
All right.
2 minutes.
Okay.
Sorry. Salman, you have 2 minutes for the feedback for each of the case.
Okay.
To
Can you please go back to the first case, Irfan, first?
Yes, please.
And tell me one minute is done because I have to give feedback on
All
both.
right. Yeah.
Yeah. Thank you. So, as a good
Yes.
attempt, I would say you need to be a little bit more fluent and confident, please. Okay.
Okay, sir.
Uh, so this is a shoulder dislocation. What I was expecting, I will tell you that this is what, as a examiner, I would expect you to answer this question. So when you see the X-ray, just tell straight away, this is a AP view with the shoulder dislocation. All right, skeletal immature
Yes.
patient. I was expecting you to identify the hill sacks on the X-ray. Okay, that's why I had to prompt you. Anyways,
Okay. Okay, sir.
and then I would then I asked you about the emergency management and the routine management. How will you manage this patient? Okay, so emergency management, you are fine. You will assess the patient and then you will reduce it. You will get the check X-ray. You will bring the patient to the outdoor. Just 3-4 lines, just a brief answer. Okay, you don't need to drag that. If they ask you or if they need something else, they will prompt you. Okay, otherwise just stick to the very brief answer that these are the things that you are gonna do. Okay, the
Okay, sir.
crux of the numbers in this table is the management and the investigations. Okay, you should come to the MRI very quickly because I had the picture. I didn't show you deliberately that if when you ask for MRI, then I will show you the MRI. Okay. And in the
Yes, sir.
MRI, there is a Bankart lesion. Uh, I'm I don't know whether you are familiar with the MRI of the shoulders or not. Okay. But
Yes, sir.
they expect you to know at least bare minimum for the MRI of the shoulder, knee, and the spine. Okay. So
Okay,
in
sir.
this X-ray, where I place my cursor, this is the where the Bankart lesion is. Can you see? I don't know. Irfan, can you
No,
please
sir.
move this cursor?
Cursor.
to the Bankart lesion.
Yes, sir.
Yeah. Okay.
Okay, sir. Got it.
Anyways, and the management wise is you will first of all you will send, if it is a first time dislocation, you will send the patient to the physiotherapy. If it is a recurrent dislocation, you will get an MRI, okay, to see
Okay,
if there is any bony Bankart or soft tissue Bankart, okay. Then the management is the, you know, that there is a table in the Campbell which specifies that how much is the bone defect, then what kind of procedure you are going to do. At least you should know about the letter J procedure, because this is the common procedure everybody is doing in Pakistan, okay.
okay, sir.
So this is a brief, I mean, feedback I can give you on the first case. And the second case, so whenever you see an X-ray with the lesion, okay, so what I was expecting, or what is the, I mean, the at least standard to be expected from the candidate, you should describe this, that this is the AP radiograph of the femur with the lesion, or you can say osteolytic lesion in the mid shaft. With, you should tell about the zone of transition,
Yes,
the,
sir.
okay, soft tissue extension, cortical break, and the fracture. These kind of things you are expected, or if you can see any calcification, okay?
Okay, sir.
And when I was telling you how will you, so whenever you see a cancer patient, so what they expect you to answer, you need to tell them that you will need to stage this tumor first, okay? Biopsy comes
Okay.
at the end. So in staging, you need to do the CT chest, abdomen, thorax. This is I was prompting you to say, but you didn't tell,
Okay.
okay?
Okay, sir.
Then you will
Okay,
get
sir.
the full length X-ray, then you will get the bone scan, you will get the MRI. And please remember, you should know the reason why you're getting these investigations. What is the reason behind them, okay?
Okay,
What
sir.
are you looking for in the things and why you are getting them? And biopsy principle is a very common question. It should be on your fingertip. You should tell this. Okay, there are at least 5, 7 principles.
Okay, sir. I know, sir.
There shouldn't be any pause in the principles. Okay.
Okay, sir.
All right. Thank you so much.
Thank you, Salman. Right. So, Asad, we will quickly go to this short case. Before that, I want to say that I'm sorry if we lost the meeting. Then I will send you another link, because I thought I have a sort of a subscription. But if it lost, then we will send you the link of the next meeting. So, sorry for that. And let's start with this case. Asad, this is a patient. She is 19-year-old. She presented to you in a clinic, and this is a clinical case. You will start with the clinical case like in your examination. So she has this wrist drop after an injection in her deltoid that was around 9 months ago. What can you see and how will you examine her? Your time starts now.
Yes, sir. I see a clinical picture in this. There is loss of dorsiflexion of the left wrist, sir. I will see the sir patient by dorsally, volarly. I will sit with the patient in front with the pillow on the hands on his pillows, on our pillows. Sir, I will look for any vesting. I will also look for the sir inner hypotenuse vesting. Then on the sir, and then on the palpation, I will look for superficial palpation and tenderness, temperature. Then I will assess the radial arterial nerve artery. I will also look for the sensory and motor component of three nerves, sir, radial, by
All right, so
making.
I'll just stop you here. So on palpation, there is no pain, no tenderness,
Okay,
pulses are
yes, sir.
fine. Now, what's your
Yes,
next step? So I'll give you the answer. I'm your patient. So you are doing
yes,
one
sir.
palpation. Okay,
Okay,
palpation is
okay, sir.
fine. What next?
Okay, sir. Palpation, sir. Then the sensory component, sir.
Okay,
Radial.
check my
Then
sensations. Where you will check my sensations?
sir, for radial nerve, I will check sensation in the first dorsal space, sir, for radial
So
nerve.
I can't feel
And
anything here. Okay, what else?
yes, sir. Then I will do the sir tunnel test in the course of radial nerve, sir. Tunnel
Okay,
sign is
so you have
for
done the
the
Tinel's test, and
yes, sir.
I can't feel any current-like sensation. You have to give me the command. I am a patient.
Yes,
Okay,
sir.
that's fine. Tinel's is negative. What next?
Okay. Tunnel negative. Then go for the sir median and ulnar nerve. Sensation is intact.
Median and ulnar nerve sensation are fine. What next?
Then, sir, I will do the motor component. I will I will say the patient
Give
to
me the
make
command. Give me the
Yes, sir.
command. Don't say me motor com. Give me the command. What you want me to do?
Do the sir, extension of the thumbs, sir.
Okay,
Check.
I'm not able
I-
to extend my thumb.
Okay, sir. Then I will also say you for the dorsiflexion of the wrist, sir. I will check motor component.
So I can dorsiflex with, but not against gravity. What else?
Okay, sir. Sir, the dorsiflexion of the metacarpophalangeal joints.
Okay, I can do it not against gravity, but so
Okay, sir.
strength 2. What else? Keep going.
Other elbow extension, sir. I want to see the level also. That I will also do. Say you.
Okay, so elbow extension is fine.
Okay, sir. Then I will look for. Then I will check the sir movement of the elbow joint and the wrist joint, sir. By
So
saying
movements
by
are
saying
fine and supple.
yes, yes, sir. Then I will
Okay.
check for the sir. Check for the muscles for the transfer, sir.
All right. What are the muscles you want to check?
Sir, I will check the pronator teres, sir.
How do you check pronator teres?
Sir, I will check pronator teres by asking you to pronate against my resistance, sir. I will resist you and say you to pronate the forearm in full extension, sir.
Okay. What else?
Then I will check for the sir FPL, sir.
FPL. All right. And what else?
Palmar Slangles, FCR, sir, FCU. I will check by saying you to make a test, then against
Okay.
my.
Is your examination complete now? Should we go to Viva?
Sir, I will, yes, I will also look for sir, any lymph nodes, sir, and star mark of injection, sir.
Okay, that's
There
fine.
also I'll check
So I think time's over, but okay, what is your differential diagnosis?
Sir, my differential diagnosis is radial nerve, wrist drop secondary to radial nerve palsy, sir, due to injection.
Okay, so the patient is at 9 months. What are you going to do?
Sir, I will do the sir X-rays.
Okay,
I will
that's
do
good.
NCS and EMG, sir.
Okay, that's fine. Let's move to the next case. I will come back. So can you look at the picture? This is a 7-year-old patient comes to you in clinic. The parents are concerned about this bowing of the legs. What can you see and how will you examine?
Yes, sir. This is clinical picture. I can appreciate there is a decreased distance between the femoral condyle, sir. And I can appreciate there is a bilateral Genu valgum deformity, sir. I can also appreciate there are the discoloration or atrophic changes at the knee joint, sir. Patella of both knee joints are facing laterally, sir. I can also appreciate there is increased intramedullary distance, sir. And I can appreciate there is a decreased medial arch, sir, on the right side. Then I will
Okay.
look, sir, from side behind, sir. Yes, sir.
Okay. What do you want to see from side and behind?
Sir, from side, sir, I want to see the cervical. I want to see the sir spine curvature, sir. Any lumbar lordosis or any flexion of the hip joint, knee joint, sir, status. Knee joint is in recovery or in flexion. Yes, sir. And the lateral part
It's a
of touching. Yes. Any